Takahiri. I'm an RN Geriatric Care Manager, Master's level, and certified in care management. And lately it seems like everyone is hanging out a shingle, calling themselves a care manager. And at times you will find yourself in need of one. So what I want to walk through is the 10 commandments of geriatric care management, what you need to look for. Number 1, you need to look at license, you need to look at credentials and affiliations. So license, the person should be an RN or a social worker, have some kind of license that's recognized in your state as a profession. The second thing is certification. The RN or the social worker or that person should be certified in case management or care management. And there are 4 that are recognized by the National Association of Professional Geriatric Care Managers. And that leads me to the other area under licensing and certification, which is affiliation. The National Association of Professional Geriatric Care Managers is at www.caremanager.org. And it is the gold standard for anyone in this profession. So that's the first area to look at. The second commandment is, what is the person's actual experience? How many years have they been at geriatric care management? I recommend at least 10 years, with about 5 years in the community area, because a lot of what happens in care management takes place in the community. Also, the geriatric care manager should have experience in the area where the elder has a need, such as dementia. You want to work with somebody who's had that experience. The third commandment is a knowledge of various insurances. At minimum, they should have an in-depth understanding of Medicare and your state's Medicaid. Ideally, it would be helpful if they also had an understanding of long-term care insurance and other insurances, but those would be the least to know. The fourth commandment is levels of care. So what do I mean by levels of care? Levels of care are assisted living facilities, skilled nursing facilities, nursing homes, hospitals. There's a variety of care that's serviced in different levels. So in order to need to know that, you also have to understand of which payers, which insurances cover which areas under which level of care. The fifth commandment is local availability. The care manager should live within a relative distance for the elder. So for example, if I live 80 miles away and I get a referral 80 miles away, it's probably not a good case for me, unless I live in Texas, where 80 miles is pretty short distance. Also, people on border states, make sure that the care manager is licensed within whatever state. I live in Massachusetts. It's close to Rhode Island, so if I service people in Rhode Island, I should also be licensed in Rhode Island. The sixth is local resource knowledge. And resources can be from local area agencies on aging to the Commission for the Blind. There's a variety of resources available that exist outside of the healthcare arena. Number 7 is, make sure you determine any potential conflicts of interest. Basically, sometimes care managers take a referral fee if they're referred to an assisted living facility or a home care agency. While in itself that's not bad, make sure you know that up front, because it could influence the choice. The 8th commandment is to inquire about the services that are offered by the geriatric care manager and availability. Some geriatric care managers provide packages, so it's an all-inclusive. Others are hourly rate. One thing to pay attention to is ensure that the initial evaluation is done in person and not over the phone. Telephonic follow-up is okay, but the initial evaluation needs to be done where the elder lives. The 9th commandment is to look at the contracts and go over any fees. Take the contract and read through it, make sure your questions are answered, know what things are going to cost so there's nothing hidden jumping out at you. And finally, where most of my referrals at this stage of the game, I've been in business for over 10 years, come by word of mouth. Sometimes you may find someone, so for example on that website that you don't know, get references. Make sure you know who's going to be dealing with your elder, your loved one, and yourself. So if you look at these 10 simple commandments, you should do pretty well when looking for a geriatric care manager. Thank you.
Thank you, Kathleen. You've been listening to Kathleen Heery, an elder care and geriatric care management expert. She's a certified case manager with a master's degree in addition to being an RN for 30 years. She helps individuals and families and businesses generate solutions to elder care challenges. She's been a national director for a large home care company, global director of care management services, and has run her own private practice in geriatric care management for 10 years. You can reach her through her website, healthcaresolutionsforyou.com. On behalf of After 50 Living, thank you for viewing this video.